Keeping It Real simulation training, starting and scaling up. Throughout the video, simulated child protection investigations are featured in a home environment, a courtroom, and a medical facility. Betsy Goulet, Clinical Assistant Professor and Principal Investigator, Child Protection Training Academy, University of Illinois Springfield. Followed by MONICO Whittington-ESKRIDGE, Chief Learning Officer, Illinois Department of Children and Family Services.
My entire career, for 30-some years, I've worked in some facet of child protection. And it was astonishing to me that over and over my encounters with child protection would be the same. I knocked on my first door, a brand new investigator, and I didn't feel like I had the skills necessary to make good decisions in a job where the decisions are everything. Why were we sending people out to knock on doors having never tried it?
The decision to use simulations came from a recommendation from Dr. Betsy Goulet at University of Illinois, and we have partnered with them to do the initial research and then also the funding to develop and design the program and model that we're currently using. I thought it was a fabulous opportunity and idea for us to really get back to experiential learning, understanding that adults in particular learn from doing and having that opportunity to be reflective about their practice.
So I started reading as much as I could about simulation training. How does it work in other industries? What does it look like? And, you know, obviously the medical profession's been using it for decades. Or aeronautics. You would never get on a plane with somebody who hadn't had a flight simulator.
We also pull from other disciplines such as nursing, such as law enforcement, also in education with helping new people learn skills and veteran staff to be able to continue to hone their skills. You gotta start somewhere. So starting small and then being able to add personnel, staffing, and funding to expand when you really don't have a big budget to do so. So that's always a challenge.
We could not have done this unless the Department of Children and Family Services said, we're ready. We're ready to take this on. We're ready to make an investment.
So we allocated those funds to start with a very small staff. At that time, it was number one bringing on Dr. Goulet as that consultant because we're utilizing the resources that are most available to us. And I think that's a key thing, that you have to work with what you have, the rich resources and those that are indigenous to the area that you're starting your simulation.
We had to conceptualize the entire training so that what was happening in the classroom had a pathway to that first knock on the door. And so we had wonderful people from the department who had a wealth of knowledge about child protection, and we just started over from scratch.
Amy Wheeler, Director, Child Protection Training Academy, University of Illinois Springfield.
We're using multidisciplinary approach and having conversations because it's not just a child protection issue with DCFS, it's a systems-wide. Simulation cases are based on actual events. They're fatalities most often. We can make better outcomes, you know, and use it in training as a learning tool.
Having the involvement of the court personnel, medical professionals that, number one, do consultation on when we're looking at new scenarios and trying to develop new simulations, as well as being there to play roles in the courtroom or in the medical simulation.
There are so many things that we want to do. I want to see cross-training. I want to see law enforcement brought in. I want to see medical people brought in and us do cross-training and learn how to communicate.
TIERNEY STUTZ, Deputy Director of Child Protection, Illinois Department of Child and Family Services.
I know that like in the Marines or in law enforcement, they go out into the field and they do their work and then they go back, right? And I don't just mean back to the classroom. I mean back to simulation training. We're so fortunate that the thing we're relying on to train our investigators is fantastic. We just need to find ways to have it continue to support them at year 1, year 2, year 5.
We are looking to expand simulations to use it with our caseworkers as well. I even have visions to use it with our foster parents for training. So this will be a great opportunity to measure over the next 2 years if we have greater retention by using simulations not only with our new staff, but also in bringing back our veteran staff and supervisors.
To explore the other resources in the series, please visit capacity.childwelfare.gov/states. Logos for the Keeping It Real series, the Children's Bureau, and the Capacity Building Center for States. This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract number HHSP 2332-0150-0071I. Special thanks to representatives of the University of Illinois Child Protection Training Academy and the Illinois Department of Children and Family Services.